Hi, everyone. I'm Geoff Hall with Around Town. And today's program, we have a face that's very familiar to Westford, my good friend, Ray Peachey.
Hey Jeff, how are you?
Ray, identify yourself.
Hi, I work for the Westford Health Department, and I am the Substance Abuse Prevention Coordinator.
But you've been around town for some time. You were background, started in 1976 as a part-time police officer,
I did, yeah.
full-time in 78, became the safety officer in 1985,
Yep.
and then you went on to take care of the Dept program from there.
Yes, that was, I believe that was 1994 that I became trained to do the Dept program, was in the schools.
Okay.
So,
Ray, so so your background when you were hired by the health department probably was a result of what you brought to the program there.
I believe so, with talking with my boss, Sandy Collins, and just the knowledge I had on the drugs and everything. I wasn't coming in with no knowledge anyway.
Mm-hmm.
Yeah.
The Dept programs still exist?
Not as much. There are still places that has DARE, but basically once the federal grants and the state grants dried up, unfortunately so did the DARE program at that time.
I remember the 60 Minutes program. It's probably
Way back.
part of what led to the demise of the Dept program, Ray. But I recall them saying that there was no visible evidence that the Dept program had anything to do. And I guess you could say the same thing going back to Nancy Reagan, Just Say No program, and any money that was put into it. What's your take on that?
I mean, I tend to agree. I can't even come up and say that, boy, it worked in Westford. You know what I mean? I have kids that I see now, well, they're no longer kids, but that have taken the Dept program, and I talked to them. I says, how'd you like it? Oh, I loved it. It was fun. Well, they were fifth graders, and at that point I was able to, I'd take a whole class, so they wouldn't really be doing a math or an English. They'd be having a little bit of fun, seeing some videos, talking about what their problems are, and because, DARE had a lot to do with drugs, and DARE stood for Substance Abuse Resistance Education. So we got into the smoking as well and different things like that. But and then with the grants, I was able to purchase stuff for them, and I'd be giving them pencils and erasers, and through fundraising, we actually went to the Red Sox game every year. And those were fun times. But I can see with that 60 Minutes, nobody really spent the money to do a intense study on, does it work or does it not work?
And what could be done to correct it?
Right. It would have probably cost them millions of dollars to do a study like that.
However, let me take you back to the 60s when I graduated from high school in 1966, and there was absolutely nothing about drugs or alcohol abuse at that time. So it wasn't even on anyone's radar screen. So at least the Dept program brought an awareness to people. What you're doing now kind of has a different twist because Dept was focused on the kids.
Correct.
And your position now with the health department is different than that. You want to get into that, Ray?
Yeah, I really, I believe the kids really know right from wrong, Jeff. They're taught TVs, hopefully the parents, which we'll talk about, and in the schools that they know drugs is wrong. They know smoking is wrong. But my focus, I really tend to lead towards educating the parents to make them more of an awareness of what is going on out there, how their kids function. One of the things we have one of the programs that we do is called Table Talks, and I would go up to somebody that would be interested and say, I'd like to use your room, a room in your house. You invite your friends into it. And we provide beverage, which is soft drinks, juice, and some kind of snacks. And it's a couple of hours of listening to a facilitator, somebody that really knows what's going on. And they tell them. One of the things is, actually teenagers, you're better off, you really want to ask them questions, ask them at night. You don't ask them in the morning. Their brains do not function fully in the morning.
Okay.
So you learn different things like this. And the parents get into these conversations, and almost everyone that we hold, I'll hear, I thought I was the only parent like that. And these are friends, you know, that should know what everybody else is doing. And it's quite the program, and if anybody out there is interested, please call me at the health department, and we can set something up. It's not going to cost you anything, just a few phone calls to your friends, and we provide everything else.
So it's like a little coffee.
Exactly
you come over,
what it is.
Let's have coffee. I'll have some of my neighbors over. Ray's going to be speaking to us about drugs.
Yeah, mostly
the
drugs.
Things to be looking for. Ray?
Drugs, alcohol, and tobacco, basically.
Okay.
And yeah, what to look for. You know, who do your kids hang around with? Mm-hmm. You know, do you know their trouble? Kids are pretty good in taking and being real nice to you, you know, as a parent of a friend of theirs, you know? So you really have to be a little more involved. And I know, you know, as parents, you know, I'm a grandfather now, but as growing up parents, they really have to get into it because these kids are smart.
Yeah.
They're very smart.
Yeah. Talk a little bit about, you said the Table Talk program. You want to talk a little bit about opiates, Ray?
Yeah. I think, why don't we start?
Yeah. George, could you put on that clip that Ray has provided for us?
Alieri was a high school football star who led his team to the New Jersey State Championship, and at 6'6" and 300 pounds, was fielding scholarship offers from colleges.
I was always that kid that was just always energetic, did whatever I could to get the win, and just tried to help out anywhere I could.
And you're good?
Yeah, I had the world in my hands.
Until, during a routine drill, he tore a ligament in his thumb.
I immediately went straight to the hospital, and that's when they did the surgery. And I remember the first pain pill that they gave me. I felt really good. I actually felt very calm. I felt a sense of confidence that I never felt before. I knew it was going to be the start of something.
You knew that soon?
Yeah. And slowly but surely, I started taking more and more and more, and then once the doctor cut me off, I started buying them off the streets.
Alieri had become hooked on opioids, the main ingredient in pain pills like Percocet and Vicodin. The good news was that buying them off the streets was too expensive to do for long. The bad news? Alieri found a cheap alternative, a drug with the very same active ingredient. You may have heard of it.
I was doing 50 to 100 bags of heroin a day, IV.
100 bags a day?
Yeah. If you're gonna buy a pill, it's anywhere from $30 to $35, and heroin I was getting for about $2 to $3 a bag. Once I met heroin, I mean, it was just, that became my new passion.
In recent years, heroin has made inroads into a much different community. People of healthy bodies and minds, young athletes. They are more likely to be given opioid pills than other kids, and 3 times more likely to abuse them, research shows. And when the pills run out, many are finding their fix in a drug that suddenly seems everywhere.
It was cheaper than the pills, but today it's like heroin it's everywhere. And especially in the white suburban neighborhoods, it's where it is the most.
This is the worst drug addiction epidemic the United States has ever faced, and it's largely been caused by the medical community.
Andrew Kolodny is the head doctor of a nationwide drug treatment agency called Phoenix House. He works every day with heroin addicts and says nearly all of them started with painkillers, especially the athletes. What's the reason that young people who are athletes get addicted to heroin?
They injure themselves, and they're more likely to be prescribed an opioid. And once addicted, many are going to switch over to heroin because it's much more cost-effective. And the effects that they produce in the brain are indistinguishable. When we talk about painkillers, we're essentially talking about heroin pills.
Come on, Ray. This is the town of Westford. I mean, that's an amazing story about an athlete. He mentioned suburban communities, but this is Westford.
But again, he was prescribed by a doctor, you know? So this is how it happens. They get into it, they feel good, all right? And then what I really would like the people to know also is that the kids nowadays will actually go into the medicine cabinets, and the ones, maybe their grandparents that don't keep track, they'll go into those and they'll take a few. They won't take the whole thing because then they'll notice it, but they'll take a few. And then they'll take a few. And then all of a sudden somebody might notice them gone, and they'll stop their ability to get to it. So now what do they have to do? They go into heroin. I mean, right now, heroin is cheaper than marijuana. That's how cheap it is.
That was part of the message there in that story. But well, I guess my point is, how prevalent is that out here?
Oh, it's there. I mean,
Okay.
if you look at the right now, the 2012 the Youth Risk Behavior Survey, the YRBS, it indicates that it's there. It's not everybody is doing it by any means, okay? But the stuff is there.
You had brought in a headline, and I guess that was the February Lowell Sun.
Yes.
Ray, you want to hold that up and just so people can see it. It basically what it talks about is 223 deaths, 40 widowed, 184 children left, 11 years, one cause. And it's about opiates in the city of Lowell.
Yes.
How does that apply to Westford?
Well, it does, Jeff, because some of our kids are actually going to Lowell. Okay, and they're passing away, and the death certificates are actually saying they're happening in Lowell with their kids from Westford.
Yeah.
We do get overdoses here. The number, I'm not sure. It's very difficult to find out exactly what it is because our files, the fire department will put overdose, but they're not, they really, not that they don't care, but they're not sure what the overdose, they just know it's an overdose, so they have to react. Same with the police department. Then it goes to either Lowell or Concord or whatever hospital, Neshoba, and from there, then they find out what it is, but it really never gets back to the police or fire. Was it an overdose and did they pass away? I mean, I had to one time for a grant that I was doing as part of a regional program, the number of deaths from opiates. And we did that. And even that doesn't really say exactly what it is. It can say overdose from an opioid, but that can vary as well.
Okay. Actually, you brought in some notes
I did.
on opiates. Why don't you
All right.
reference to some of those, Ray?
First, people talk about opioids and opiates. The difference being an opioid is derived from an opiate. The opiate is what comes out of the plant, the puppy plant. In 2013, the state of Mass had 908 overdoses. 808 were unintentional. Now, there may be even 100 more that we're not sure because, again, the death certificates sometimes take a year or so before they get up to date. We were averaging, in the last 17 months, we averaged 58 overdoses a month. February 2000...
In Massachusetts.
In Massachusetts, yes. February of 2014, there were 115 overdoses. That's a 30% increase from 2012. And that's the latest figures that we can get right now. So one of the things I wanted to talk about is what does an opioid do? And it really, it suppresses, it suppresses the pain, but the perception of the pain, that's what I want. It suppresses the perception of the pain and just gives you an emotional relief. So
it's a high then.
It's almost a high, yeah, very good, yes.
Well,
yeah.
I was going to say, if to make someone, it makes them feel different than they did before, and it makes them feel good.
Correct.
Okay.
So when that pain is finally subsided, they still want to feel good.
Sure.
But their body needs to feel good, not want to feel good. Their body needs to feel good.
Yeah.
And then, then they go and they either buy it on the street or they start stealing it. And then now they can't steal it anymore. They go to heroin because it's so cheap, and then they get hooked on heroin.
I guess, Ray, but when you see something like that, doesn't mean every athlete
Oh my
that
God,
is
no.
prescribed, but this is more or less, hey, be aware that if you have a child, okay,
Yes.
or be aware of the drugs that are in your medicine cabinets, and be aware of those things. If you suspect something, don't let it go.
Correct.
Because this could in fact be the result. As I said, the opiate gives a kid a high.
Yes.
Okay, or
Yes.
gives wherever it is.
Yeah.
It's interesting. I just had knee surgery, had a brand new, and they had given me an opiate,
Right.
quite frankly, to kill the pain. And I was very careful about what I was going to do. In fact, what I ultimately ended up doing when I finished with the ones I've
Right.
used, I turned them back into the pharmacy.
Pharmacy, yes.
They'll take them back, the
Yes.
ones you're not going to use, which I would recommend to any parent.
yes.
Okay, or anyone that has those. When you're not using, when you finish with them, get rid of them.
Yep.
Don't flush them down the toilet because
No,
they'll go into
no.
your water
System.
supply.
Yep. I mean, we have a disposal box in the police department.
Okay.
Okay. We have one for drugs on one entrance, one side, and on the other side is for shops, the needles and things like that. So they're two separate. You can put them in there. You have to take them out of the plastic. You don't want your name on it anyway. Put them in a plastic bag. Just drop them in there anytime, 24 hours a day.
Yep.
And definitely get rid of them.
Ray, what should a parent be looking for? I mean, it's you told me before the show. You said with the DARE program, you went in and talked to fifth graders. You talked to students. You would talk maybe to high school kids at one time or
yeah.
another.
Yes.
But your role here is different because your focus is not on kids now; it's on parents. What are the high points of that?
I mean, you watch their pupils get dilated. Are they nauseous? Who do they hang around with? We talked about just a little while ago. We talked about that. Find out what their friends are doing. I mean, somebody on drugs doesn't mean they can't get A's. I mean, they're not the ones that we used to see way back in the movies. In the tiered clothes, homeless. Okay. These are middle class, upper class, lower class. It's the whole gamut of people can get hooked on them. And they don't have to get hooked on them intentionally, as we saw with that athlete.
Yeah.
I mean, we need to, as parents, we need to look at the kid. Okay, you have so many. Talk to the doctor. Does he really need to use all these? No, but just in case, well, all of a sudden they're gone. Well, where'd they go? Okay, so we need to keep an eye on our kids as well and make sure that they're not overusing the drugs.
What advice would you give? Okay, I'm a parent, and all of a sudden I find out somehow that my son or my daughter has been using and possibly abusing drugs and alcohol as well.
Yeah, any of them, correct, yeah.
What should I do?
Confront them. Don't be afraid to confront them. Find out, and this may not be, yelling at them as much as let's talk. Do you have a problem? I mean, I want to help you.
So it's communication.
No question. That's the biggest thing. I mean, and that communication started way back in the DARE program in the 5th grade. You know what I mean? That was one of the things. Prior to starting the class with the kids, I'd have a parent talk. And for the school, that the parents would come in and I'd discuss some of the things. Make sure you communicate. If you can communicate with your kids, it's amazing what you find out.
Yeah.
They're not going to tell you everything, but I mean, just have an idea what they're doing, where they're going. How are they acting? Are they sneaking in, sneaking out? Just different stuff like that. And then you have to find a place that, if they are addicted, that would help them. And they can call me up there at the health department. 978-399-2528 is my phone, and I can email them a number of places that they can go for help.
I guess that would be the next thing. You communicate with your child, and you find it breaking down, and you find out the problem persists. When do you go to the next level, and what is that next level?
That's a hard thing because the parent knows their child. I mean, I've talked to many parents as a police officer, especially with the DARE program. A lot of them would come to me, and not 5th graders, but the older ones. And what do I do? I can't do that. What do you mean you can't? Well, You know, I mean,
Is
I
there a
can't go in their
stigma?
room. Yeah, I can't
Is there
go
a
in their
stigma?
room.
Yeah.
I'm sorry, you know, myself, I'm sorry. That's your house. What do you mean you can't go in their room? Please, go in their room. Look around. It's amazing. Westford Against Substance Abuse and the health department put out a display one time on the gym at the Blanchard. We had a talk. And you have no idea, a Coke can. It looks like a Coke can. Screw the bottom off. You can hide anything in there.
Yeah.
The different things that they had was incredible that you can buy. And they weren't made for drugs. Normally they were made to hide jewelry. But now we can use the drugs and put the drugs in there.
You go beyond just substance abuse. So you talked a little bit about tobacco as well, Ray.
Yeah.
And certainly, you know, tobacco is addictive. It doesn't
Yes.
get you high,
No.
but it certainly can kill you.
Yes.
Okay?
Yes.
So you want to talk a little bit about that?
And just for a point of that, my father was a smoker for many decades, and he passed from COPD, and you really don't, that's just a tough thing to go,
Yeah.
you know, so, but yeah, we just need to really be on these kids, you know, I mean, you can smell it on their clothes. Maybe they might use breath spray, but you can smell it on the, if you're a non-smoker. If you're a smoker, then it's just normal. You can't do that. You know, and they talk about ways of getting off of it. It's very difficult. You know, you think that you can, you know, the kids think they can smoke, and then, yeah, I can stop whenever I want. It's not that easy to stop.
No. From a former smoker,
Yep.
and I haven't had a cigarette since September 29th, 1987, but it wasn't easy.
Yep.
It is very difficult. So.
Yeah, no, and so like you say, it's difficult to get on, and it's no good for your lungs.
Yeah.
You know, the chew is same thing. It still has the nicotine in it.
Is that any part of the program you're working on now?
We do that. We part of the parents program again is to talk about the tobacco and alcohol too. So
Okay.
it's the whole gamut of it.
Yeah. I guess, you know, when people think of drugs, they think of the opiates, they think of heroin, they think of, well, here we go. Today's paper.
Yes.
Mass General Hospital teaming up with Western students on marijuana study. Okay? Now, I don't know if you've had a chance to read this is dated May 7th, but it says in 2012, half of Westford Academy seniors they had smoked marijuana at least once before in a youth risk behavior survey that Emerson Hospital conducted for school district.
Yes.
That's bothersome, is it not?
Yes.
But
yes.
it doesn't mention alcohol either.
No.
And that's a drug. Whether
Oh, yes.
you know,
It definitely is a drug. It really is, and it's there. It's addicting. It can be addicting. You know,
it certainly
one
can.
of the things we talked about in the Dept program, and again, we're talking fifth graders. I would say to them, listen, I'm not here to tell you not to drink when you get older. I'm here to tell you to drink responsibly and not to drink till you're around 21 years old because your liver is not formed. It can't process the alcohol.
that's a very interesting point. I think that sometimes people miss. Well, you don't drink till you're 21. Why? Because your body is not ready to absorb it.
Correct.
So,
Yeah, and that is one of the biggest things. You try and get this all out, but it is hard for the teenagers. We were teenagers once, way back when, Geoff, but
Yeah.
we were, you know, and you look at some of the things that we did, and you say, how the heck did I ever make it?
sure.
But all we can do is just educate, you know, but it really, I find it has to start at home, Geoff. It can't just be in the schools.
Yeah.
You know, or if it's in the schools, it has to be reinforced at home. And if you can do that, you keep an eye on the kids, you start from day one, you know, and just find out what they're doing. Look for them. I mean, there's a whole list of different things that you can look at, and you can very easily Google it, you know, signs of opiate use.
yeah.
Okay, and it'll give you a whole list of signs that will help you, you know, so, and then, you know, remember, don't go after the kids. I mean, hey, it looks like you're on drugs. We all know that that's no good either, especially if they're not. Boy, you lose all kinds of confidence with them there, so.
These table talk things, when would you recommend parents begin to look at, you know, offering these types of things?
Middle school, table talks is really good in
Okay.
middle school.
That's what I was thinking.
Because the kids tend to change. That's why DARE started out in the 5th grade. when they start going into the 6th grade, that age group, their minds start changing, and we want to try and get a basic set for them prior to their age for the 6th grade, 7th grade or 5th grade, and get it set maybe in a straight line.
Okay.
And we used to send things home for the parents to read and stuff like that. So it's very important. It really is.
Yeah. So what you're saying is, if you're the parent of middle school kids, even if there's nothing at all, they don't see anything, you would recommend that they get involved?
Highly.
Don't wait until something happens?
Correct,
Okay.
highly. Even if your student is an all-A student, okay, and you suspect nothing, there's nothing wrong with spending, 2 hours, 2 different nights, and finding out how that brain operates, because it will help you in everything else. We're not just talking drugs, alcohol, and tobacco. We're talking everything. Again, that thing, talk to them at night. Don't talk to them in the morning. Well, that doesn't go just for drugs. That goes for everything.
Yeah.
You know what I'm saying? So we can do that, and you learn stuff like that, and you go through studies. We go through the YRBS. We're now waiting for the 2014 YRBS to come out.
What's the YRBS?
Youth Risk Behavioral Survey. That's the
Okay.
one Emerson Hospital does
Yeah.
every 2 years. And, thanks to Emerson Hospital, because that costs them a good deal of money. And we do, the school department does put out some money, but not compared to what Emerson does. And it really helps us just to gauge, and they ask all kinds of questions, not just drugs, bullying, sex,
Okay.
everything, riding in a car, drinking while riding with somebody, or just drinking and driving, or were you ever in a car with somebody drinking? So it really gets, and when that comes out, you can get that on the Westford School Department's webpage. The 2012's there right now if they wanted to look at it.
I guess the message, when you say, and I tried to, make that point, come on, Ray, this is the town of Westford. We're a upper middle class community with high standards and wonderful things in town, but these people who are addictive have addictive personalities.
Correct.
And may not even know that.
Oh, yes.
And become falling into this pattern, because that's just the pattern you fall into if you're physically and mentally an addictive personality.
Yes.
And it could be hereditary, and it could just be the way their genes are set up. I don't know the medical reasons for it, but so parents should be aware. I appreciate you coming on, Ray.
Yeah.
I think your message is important. And if anyone has any questions, they can certainly call the health department.
Yep.
They can notify you. If they think one of these programs is worthwhile, they can get in touch
Please
with
do.
you.
Correct.
And I know they'll see you around town, because you're around town
Oh, yeah.
all the time.
Yes, I am.
Ray, thank you
Thank
very
you,
much for
Geoff.
coming on.
Thank you very much.
See you again around town.
Yeah.